This video demonstrates the application of the Thomas Splint traction. Some parts have been sped up and others slowed down. This is not to replace your training, but simply an aid to help you if David and I are not around. Gather the equipment you need and set it out on the bed, getting various sizes before you can measure the child. Measure the hoop on the uninjured leg, making sure you can get your thumbs either side of the hoop so it's comfortable. Ensure there's 20 to 30 centimetres extending at the bottom of the frame. Fit the splint together using the sizes that you've measured. And then use the ring protector, secure that with the Velcro. Position and secure the slings along the splint. These should sag slightly to support the limb and accommodate the natural shape of the leg. The distal sling should end before the heel of the patient. This can reduce pressure sores. Secure these with the Velcro provided to stop them slipping. Add your layer of gamgee for comfort. Now we're going to add the skin traction. Make sure the string at the bottom is in the centre, ready for the traction to pull. Ensure the foam goes over the ankle bones and make sure there's enough room between the bottom of the foam and the foot to allow full flexion of the foot. This is too short, lengthen it, like this. Next, put your tape on as smoothly as you can on either side of the leg, making sure that there's no kinks or dents. Get this as high up the leg as you can. When you're cutting it, dome it to create a round edges. This is to stop traction pull and some skin shearing. And do the same on the inside of the leg. Again, dome the tape. Make small incisions, as you can see, and this allows the tape to flatten against the skin. Next, bandage over the leg, using one bandage at the bottom, making sure the Achilles tendon isn't wrapped, and using a figure of 8 motion. Stop below the knee and tape this. And use a second bandage for the top of the leg. Next, put the splint under the patient's leg, pushing down onto the bed, and bring the splint up to the patient's leg, resting it so they're comfortable, ensuring that the Achilles tendon is free of the slings. Secure the traction cords from the skin extension to the end of the splint, passing the outer cord over the lateral bar of the splint and the inner cord under the medial bar. This prevents external rotation of the limb. You should be left with this diamond-shaped effect. Next, get your windlass and tighten accordingly. Please do not use tongue depressors to do this. Bandage over the whole of the splint and tape. At this point, after a set of neurovascular observations, your patient can be transferred to Buxton Ward. Once on the ward, rest the patient's leg down on a vomit bowl and add the swan neck to the end of the bed. Tie the second bit of rope as shown. Attach to the swan neck, going under then over and over. Add your weights, ensuring there is at least 30 centimetres from between the weight and the bottom of the floor. Ensure there's adequate space between the end of the bed and the traction so it's not butting at the end. This should be guitar string tight, the windlass should be secure. Ensure that the patient's heel and Achilles tendon are free and not onto the bed. Make sure the bandaging is smooth and comfortable. Check this is not too tight at the top and check the overall comfort of the patient. Thank you for watching. We hope this was really helpful for you. We welcome any feedback. Thank you from David and Alice.